covid.joshcutler.com. Why is this not coming up?
Do you want Max just muted?
Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, please email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional programs that Pembroke has had, visit pactv.org/Pembroke. I've done this so many times. Sabrina Chilcott, Pembroke's Assistant Town Manager, will be moderating the forum and will introduce the participants that are contributing today. Welcome, Sabrina.
Thank you very much, Julie. Good morning. I know it's been a long week, hasn't it? Anytime you get a holiday, it acts as though you just double your fun for the rest of the days of the week.
Absolutely.
So this morning, we really want to thank everybody for joining. This is the Thursday COVID-19 forum update from the Pembroke Emergency Management Agency in the town of Pembroke. And Thursdays, we tend to focus on the facts, considerations that the emergency management team goes through every day when they meet every morning at 10 o'clock. So to that end and to that point, we have welcomed today Lieutenant Rick McDonald of the Pembroke Police Department.
Morning.
Deputy Chief McCormick of the Fire Department.
Good morning.
Good morning. And Health Agent Lisa Cullity. Good morning, Lisa.
Morning.
And of course, State Representative Josh Cutler. Very grateful you could join again. This is important times. And one of the things we've seen on the state and the federal news, when you turn on any of these, sourced news outlets, you see that we all work better when we work as a team. And when surrounding communities come together to make consistent decisions and work together, and when the actual body inside your own town and your own community is on the same page and moving forward at a reasonable rate. But to take a step back from where we are today and to push off for a few minutes the whole, forecasting the future, I wanted to ask Lisa to start by telling everybody who's tuned in and who asks every day, where does Pembroke source its data from? The health department has to support the public health nurses and take on board case information and share certain things and absolutely not other things. And where do those numbers come from? How are they derived? And how do you support those public health nurses?
Sure. So the way the system is supposed to work in a perfect world is disease surveillance is something, again, we've done long before Maven, long before COVID ever existed. And it's done on a web platform called Maven. And Maven is the infectious disease monitoring surveillance program set up by the state that's used by every health department in the Commonwealth to track a myriad of infectious diseases, COVID being the latest of many. Here's the problem. So as COVID testing is done, it's done at multiple locations, it's done in multiple formats, and it is all supposed to be sent to the state lab. Not that the state lab is doing 100% of the testing anymore. That's not the case, but that's where the information is supposed to go and be loaded up onto Maven. That is occurring. So the question is, what's going on with the data? And of course, we've seen this in the local headlines as well as the national headlines is, well, what does that data mean? And where's that data coming from? And how accurate is that data? And Nancy and I are working very closely on tracking cases that we're familiar with, that we know a lot about, to see what that looks like. In other words, people that are sharing personal medical information voluntarily with myself and the public health nurse, that allows us to kind of test the system, for lack of a better term. And right now, it seems like the system, from someone becoming symptomatic enough to qualify for testing versus testing results going on to the disease surveillance network, is approximately 48 hours. It's working its way down to 24 hours, but we're not seeing that 24 hours hold in every case. So when someone meets the criteria for testing and is tested and then is put on the disease surveillance network, it is somewhere between 24 and 48 hours. Is the system flawless? No, it is not. things like human error. Unfortunately, we know of a case very tragically where the patient X passed away before being tested, but showed all the signs, symptoms, and everything else of COVID, and had absolutely no underlying medical issues. And I want to say that again, no underlying medical issues. The person was just barely 60, but with no complications, no smoking, no histories, no COPD, no nothing else that would make them high risk. And from the time that they were feeling ill to pass was 48 hours. So that's really scary. But so we're
No,
testing
no.
the system out to
Josh
see what
might
it is. But
ask,
that
and if he
particular
does, then you can
individual
take
that
it
we
and I'll
knew
hit F11.
quite a bit about,
So
that
listen
that
to Josh.
person's family
Thanks.
shared a great deal of information voluntarily with us. There's no doubt in our mind that that person did pass of COVID and was never tested. So when we
At
go
least-
back to data, I'm sorry.
No, it's okay. But that actually is a news story that's coming out. And I saw it
Mhm.
posted this morning that's true
Sure.
in every community where everyone is
It,
going
it
through
is.
that same kind of thing. Now,
It
will you
is.
explain when you say that you are using the information you have and the voluntary
Mhm.
dissemination or distribution of information
Yep.
from patients if they choose to share?
Mhm.
Can you explain what that tracing protocol looks like and then where does
Sure.
that go?
Sure. So if someone is a positive, this is not public data. This is not something that's disseminated for the public at large. This goes to the Pembroke Health Department and the public health nurses that are actually doing the disease surveillance. And the state's going to be stepping in and doing a lot of this disease surveillance with their partners in health moving forward. But this is not public data. No one's name, address, age, or anything else like that is out there publicly. However, there are some people that reach out to Pembroke Public Health directly and share some data in the interest of being helpful, which is really great. So that is where we're talking about data outside the system that we're getting. And if people want to reach out to the Pembroke Health Department because they have contracted COVID and they're willing to share their experiences with the system, good, bad, and otherwise, obviously, this is how we collect data, and this is helpful to us.
Hey,
But
Lisa,
in a
just throw that phone number out there.
Yes, I'm sorry, 781-293-2718, Pembroke Health Department. And obviously, given the circumstances, don't be shocked if no one picks up the phone, but just leave us your name and number and we'll get back to you. But then moving forward, so in a perfect world, someone tests positive. In a perfect world, you're going to receive a call in 24 hours or less from some public health nurse. In a perfect world, you're going to know where you've been in the last week and you're going to go over who and where you might have had close contact with people, and you're going to hopefully be able to at least give us some source locations and or exact people you had direct contact with. And then the public health nurse is going to go and call those people, contact them, let them know they might have come into contact with someone with COVID. Depending on their own medical circumstances, they may end up qualifying for testing or not, depending on their circumstances. And we would move forward from there. Anyone that is tested positive for COVID is ordered to quarantine for 2 weeks. That means no contact with anyone outside their home for 2 weeks. Anyone else living in the home should be quarantining with them for that 2 weeks to avoid the spread of the disease, obviously. So there is one exception.
If they're
Mhm.
transported, they want to share that information with you so first responders
Absolutely.
can be notified. Is that correct?
Absolutely. And that's something that, is a moral obligation. Obviously, if someone wanted to lie or be deceitful, they, I guess, could, but it would be detrimental. There's no legal ramification for not sharing this information. So I can't see why someone wouldn't want to be. So if someone is transported or has had interaction with any kind of first responders or other medical people, maybe they went to their own doctor or to a doc in a box kind of situation, they would absolutely want to share that information. And there's no, I think that's the other thing that's important to say, there's no legal ramification. So it's not like there's going to be something held against you for sharing this information. There's no fallout. It's a protected piece of information. So there's no downside to sharing it.
And in contact tracing, when the public health nurse would reach out, they would just say you've come in contact with someone. There's
Correct. There's no identifying situation with that. They would just let people that have been in contact with positive, we'll call it patient X, that they've been in contact with a person that has COVID. There's no identifying, there's no naming the person. That's not how that works. They just let them know we have reason to believe you come into contact with someone with an infectious disease.
Thank you. Thank you very much. All right, Deputy Chief, I have a question for you.
Go ahead.
You're advised that there's a potential at a specific location that emergency responders are going to want to be careful with. That's all the information that you received. Is that right?
Correct. So when someone calls 911, our police department through dispatch will ask a series of questions that were given out through the CDC. They will then pass that information on to us so that we're aware that that person may have some COVID type issues on our way there. It's not always the case. You could go for, a person that fell and you're going to help that person, but he has someone in the house that has flu-like symptoms. That doesn't get passed on because we're not going for that person. So sometimes it does get lost in the shuffle, but for most of the time, the police are great at sending us the call. We know what we're going to. We gear up. We go into the house, and then our guys are very cautious, and they have a protocol that they follow. Well, they'll ask questions that if that person has those 4 or 5 classic symptoms of COVID, then we'll come back here and do some documentation, and we'll kind of wait for the results.
And you would be notified that you potentially could have exposure to someone.
Correct. So we have a mechanism, not through DPH, but through OEMS, under the Ryan White Act, that we can, if we believe we're in contact with a infectious disease, we have the right to go through proper channels to get that information.
Understood. And are you seeing calls, for example, routine calls or calls of people in general distress the way you would see on any other given day? And are people taking care of themselves and reaching out for things that aren't COVID related?
Yep. So we're still responding to the everyday medicals and calls that we responded to before COVID came. I will say, and I've said it on the umpteen million shows that have been on since it started with Lisa, that people are waiting longer than they normally would to seek medical treatment or medical help due to the fact that they don't want, or they're afraid, or they have it in their head that if they go into the hospital, they're going to be put on a vent and never come home. So people are waiting longer than they probably should. And I keep on telling them not to. If you're sick and you're not feeling good, we'll take you to the hospital. The hospitals are segregated. There's a COVID floor and a non-COVID floor. So, the chances of you going for a heart issue, you're not going to go to the COVID side. You're going to go to the cardiac side, and you should be all set. There shouldn't really be an issue. So I would not stay home and wait with signs and symptoms of, some medical condition because you're afraid. We're here. We'll take care of you. We'll guide you through the process as best we possibly can. But it doesn't make sense to stay home.
No, that's great information. I don't know how many people are actually aware of that. And where you guys are in and out of those hospitals regularly, you have that information to share with people. It's important.
Yep.
Now, Lieutenant McDonald, I have a question for you. There have been a lot of new protocols put in place, and I don't think they weren't already identified. They were. This is a stand-up of a routine nature, so to speak, that became less routine as time's gone on. But when those protocols were put in place because of the declaration and the identification of this COVID virus, you have officers who are wearing different things, who are asking different types of questions, who've had to change their profile a bit on the job. How's that working out, and how is the department doing with the new normal?
Well, it's clearly obvious that we're wearing the mask when we're out there in public. Sometimes we wear the gloves, but more times than not, we're trying to lead by example. So if we expect the public to do the same thing, and that's why we're putting on those masks. You don't need to wear them when you're in the car, just when you're outside in public.
Understood. Representative Cutler, I do have a question for you again from their local news. And when you start seeing daily different towns and cities, we've seen Brockton and Quincy, Cohasset, Hingham, now Marshfield, have all gone and debated the wisdom and implemented mandatory facial coverings for their residents. Now, that is obviously a topic under discussion by all emergency management groups in every town right now. And as Pembroke goes forward, your advice is going to be very, very important to all of us. Not that it's a question of should you or shouldn't you, it's a question of the PEMA's decision on safety and protocol and enforcement. So what kinds of feedback are you hearing from the rest of your district in regards to working through that issue?
Yeah, great. Thanks again for having me on. It's great to catch up with you guys all virtually. Thanks for all the great work that Pembroke is doing.
Oh, good.
Very proud of all your efforts. So, and if you can add to that list, the town of Plymouth actually just announced their Board of Health voted to require facial coverings in public spaces. And we're seeing a lot of towns moving that direction. Obviously, the state's position, and I believe even the federal government's position, is that is recommended, not necessarily required, and that's been left to individual jurisdictions to make that decision, which kind of makes it a little bit more difficult on local officials having to make that call in some cases. Although having the flexibility is also a consideration. I think the message should be to everyone that we should be wearing facial coverings, and I certainly would support that. And it's whether or not it's a requirement, we're going to have mandates and enforcement. That's really a trickier call, I suppose. But I think it all needs to be based on public health evidence, and that's really how it should be done. And I have faith that whether it's Pembroke or any community, they'll make the best decision for that community. But certainly, I think the message should be that to everyone that you should be wearing facial coverings when you're in public spaces. And certainly, grocery stores. A lot of talk about what should be done about grocery stores, and I think you might see some more guidance from the state on that soon. If I could just quickly touch back to what Lisa was talking about while we have a moment about statistics and data, because there is some news from Beacon Hill, where I'm not literally at right now, but I have a nice new background. And the House yesterday passed legislation through the Elder Affairs Committee that will still pending in the Senate, but that would require additional data reporting on long-term care facilities. We've seen, sadly, that has become the flashpoint for this crisis. More than half of the deaths have occurred in long-term care facilities across the Commonwealth. And so the legislation that was approved by the House would expand, number one, it would expand the definition of long-term care facilities, because there are what we call independent living centers, there's many on the South Shore, that are not specifically defined as long-term care facilities. And so they're not getting the enhanced reporting that we're seeing at nursing homes. And so expanding the definition of long-term care to be sort of all-encompassing. And also, secondly, making sure that those facilities report daily to local boards of health and also to the DPH with cases and mortalities among the residents and staff. And then DPH would make that data publicly available on its website as well. So that was some enhanced reporting that there was the pass in the House yesterday that we think would help to give more tools to our local boards of health and also to DPH to make sure that we're all aware. I've gotten a number of family members, nursing home and assisted living facility managers reaching out to my office, just concerned about what's happening, and many they're being very proactive and doing all the right things, but they're still obviously very concerned about this issue, as they should be, because we've seen such a high incidence rate. So wanted to mention that is happening. Hopefully that will move through the rest of the legislative process very quickly, but I think it's obviously something that needs to be a focus.
Thank you.
Yeah.
All right, Lisa, question about Pembroke. Thank you, Representative Cutler. Good information. Group homes and flashpoints. Not that I put those two words together, but nonetheless, Pembroke has its share of facilities with combined populations that rely on staff interaction. And the staff oftentimes comes from another area, maybe isn't actually living locally. Can you talk a little bit about what kinds of facilities we have in town? When numbers are tested, what is the yield and some of the larger pops that we might see as that goes forward, and just sort of give anyone watching a background on what that looks like for us locally, because that's very good information, Representative. Thank you.
Yes, it is. So I think it's important for everyone to take a deep breath and consider a couple of things when we talk about consolidated populations. And I'm using the term consolidated populations because they are just that. Sometimes those populations are of a certain age or a certain need. And we have 3 consolidated populations within Pembroke. One is a needs-based group, one is a medically based group, and actually 2 of them are a needs-based group. I'll classify them as a needs-based. Age plays a factor in one of those facilities, does not play a factor in the other. And the last one is a medically based. So whenever you have groups of people living in close proximity, sharing food source areas, i.e. cafeterias, you're going to see a higher transmission of any disease, COVID or otherwise. So naturally, these facilities, unfortunately, through the best efforts of the facility managers, are going to see a higher indice. And we're seeing that across the Commonwealth. The other challenge that those facilities have is often there are a heightened need of personal support services or medical support services, or both. And depending on the population and the facility style, that could involve outside medical professional help, and often does, rather than live in facility help. So when you have a transient medical support population coming in and out, there's a very good chance that that medical population doesn't serve just the community that they're working at, that might develop what we call a hotspot or a cluster of cases. It's often that they're traveling between multiple different facilities doing different kind of work. So for the medical professionals, obviously this is a really tough time because they are traveling from facility to facility often with the chance of picking up coronavirus at any of those facilities, and if asymptomatic, possibly transferring it to other facilities. So that begs the question, well, why don't we just have anyone that's possibly exposed to stay home? Well, if we did that with our medical service industry, we would be shutting down every hospital in the Commonwealth tomorrow, because quite simply, all those people have been exposed. Every nurse, every doctor, if we did the strictest interpretation of contact tracing. So we can't do that. So we have to accept that there's, because of the medical needs and because of the support needs of certain populations, that the medical personnel going in there have a high likelihood of carrying the virus with them. So how do we combat that? We combat that with using all the best safety and protection gear, not only for the medical staff going in and out of the facilities, but also for the staff within the facilities and then the patients within the facilities. So Pembroke Emergency Management Team, myself and the deputy fire chief, are pretty much in daily contact with all of our group living facilities of any style. We're staying in close contact, one, to be supportive. That's the first and the foremost thing. Two, so that they can report any indices they have. All of our group home livings have either been tested or in the process of being tested. We are seeing some spikes in numbers associated with that. We're monitoring those cases, as are the facilities that have those cases within them. We're hoping for the best outcomes. We understand that we might not always have the best outcomes. Unfortunately, that's part of this disease. It's part of the sadness of this disease, but it's also a matter of a statistics thing that it's going to happen. So we do the best we can. And I have to say, overwhelmingly, the facilities we've been in contact are literally doing everything they can. They've been responsive at every turn. They've been very transparent with Pembroke Emergency Management about the actions they're taking. They're talking about any enhancements they can do. They're sharing ideas with Pembroke Emergency Management. And asking for input if we see areas for improvement. And we've made a couple of minor adjustments, but for the most part, these facilities are really ahead of the curve as far as the guidance of what they should be doing. And my hat's off to them and their staff. It's got to be a very scary time to be in that line of work. And I really admire them that they have all seem to be enjoying a very dedicated bunch of staff there doing the work.
And I have a question for you on that topic, as a matter of fact.
Mhm.
Pembroke Emergency Management has supported every one of them with materials, time,
Yep.
and that very important PPE, in the sense that walking around, not N95 masks, but procedural masks. We've had a reach out in the community for handmade masks or facial coverings, excuse me. And to that point, we're going to need more. And I was going to come into this sideways, and I was going to bring the rep with me, which was going to be a little strange. But, the governor on Tuesday, when he discussed schools and early child care or early childhood centers, education centers, alluded to a third quarter, as though he was almost saying that our peak, which we know we're in, may be getting to that place where we can start looking ahead to things we don't need to go to yet. These future discussions and business offerings and everything else. We'll talk on some of that on Tuesday when we get back to the other aspect of this forum, but back to the materials that we may need.
Yep.
How is Pembroke going to stay in the long haul with all of the equipment and accessories that go along with the new projected future, especially if we're coming into, maybe we're leaving the peak going to the third quarter, but that's not really going to change what we're doing. If we're talking today about facial coverings and potentially mandating them, what resources does the deputy chief and the lieutenant and the health department have at their disposal? And like you've done with the group homes, how can we make those available to others?
Sure. Well, the hope, we all have hopes, right? So the hope is that the manufacturing industry, especially with some of the redirections that they have been instructed to do, are going to be producing more masks. I think there's a lot of misunderstanding about facial coverings. I've heard statements like, I'm not wearing a facial covering, I'm not scared. Facial coverings, when you wear them, are not for your benefit. Yes, they do benefit you, but it's mostly so that the droplets coming out of your mouth as you breathe normally, as anyone with glasses knows that's wearing facial coverings, I have to have sympathy for my husband just then. I don't have that problem, but Sabrina, I'm sure you can sympathize a little bit. But so anyone with glasses knows you naturally respire, and as you breathe, droplets are leaving your nose and mouth, and that's what we want to capture. So any generic fabric will capture a lot of those. Now, there's a lot of internet scientists, and my hat's off to them. They're right. No, those facial coverings are not going to capture every germ and every molecule. They're correct. However, they're going to catch a largely portion of it. You're going to reduce the opportunity for a virus to leave one person and go to another. Secondly, and there's a lot of studies on this, if the person next to you, you're wearing a facial covering, call it a bandana, and the person next to you is wearing a bandana, obviously the odds of a droplet leaving person A's mouth and then passing through their bandana, then passing through your bandana and passing through to your mouth or nose is going to be very drastically reduced. Is it perfect? Is it an N95 level filtration? Of course it isn't, but it is a significant reduction. That's what we're looking for. So when people talk about the N95 masks aren't available, N95 masks are really designed for the medical community, or if you're in construction and some other things when you're working around toxic items, for a level of filtration so that you can be around such toxic and or viral and or bacterial things and protect your breathing. The average person walking around does not need an N95. Just below an N95 is a surgical mask. Obviously, a surgical mask is such that surgeons wear it to avoid breathing on their patients, as well as to avoid breathing in anything they ought not. Those are the next best. I'm thinking that surgical masks are going to be much more widely available than N95 masks in the near future. But again, getting back to facial coverings, really any kind of facial covering is going to offer a much greater reduced opportunity for you to expel droplets onto another person. And also, should someone expel droplets on you, it's going to help mitigate the opportunity for you to ingest those droplets, which is how the virus is transmitted, other than you touching the virus and then touching your face and applying it to yourself that way.
Thank you. We're starting to see some products restock. We're seeing
Yep.
Laboratories and different factories retrofit and change, distilleries in Plymouth making hand sanitizer. Saw in the news, L'Oreal is making hand sanitizer. Hey, this is the new way we're rolling. So the group, I assume, is in discussion regularly about trying to stockpile and replenish stockpiles.
Yes.
Is that correct? And
yes, and we have.
Cutler, can you talk with the health agent back here a little bit about some of those resources that are available?
Sure. Governor Baker updated us yesterday. So far, there's been 5.3 million pieces of PPE that have been delivered across the Commonwealth. There's a process, and our health agent and public folks know this well, that you go through to request PPE through our regional health coordinator, or Region 5 here. And so we put in our request through them, and then they get to the command center. And so that process has been ongoing. I know that has been happening because I know some of you have put in those requests. Obviously, I would say if you have problems with that and run into roadblocks, so please contact me. But that process seems to be working. And obviously, there's a high degree of need for the PPE. And I guess I would just reiterate that for the for the, it's really our first responders and our frontline folks that need that. And for the folks like myself who just need a mask, wearing the ones that are, handmade and so forth is much more appropriate. So we're not taking from that stockpile. But there is a process in place that the state has to distribute that. And the new stats that the state puts out actually have expanded to show exactly where all the PPE is going, both in terms of what geographic area of the state and also what kind of facility, long-term care facility, police and fire departments, other kinds of agencies. So there's a lot more data out there now showing that, and I think they're doing a good job of trying to be transparent about it.
Lisa, how is it transported to Pembroke? What do we receive it in, and where does it go?
Sure. So the police and fire both received deliveries that were brought to them by the National Guard. Our public health department's shipment was shipped through generic shipping service. I do not believe it was one of the name brand services. It was a generic shipping and distributing service that arrived here. All of our quote unquote allotment of PPE has all been distributed to first responders and to those group living conditions that I previously described. I do know a lot of people were saying, well, what about citizens, and is there dispersal available to citizens? And the short answer is no. I know that the police and fire each received a shipment, but the 1,000 surgical masks we received here at the Board of Health, as well as some face shields, some Tyvek suits, obviously those are all better used by our first responders and more needed by our first responders. And some of those surgical style masks have been distributed to those group living conditions, both for the use of the staff as well as the use of the patients. I know that they have received additional supplemental shipments from the state as well, because that's where we're going to have the critical face-to-face and the proximity issues that require that specialized gear. Again, for the average person, your homemade face covering is going to work. In addition to that, we've also been sent some money from the state, which we are looking around to see where we can purchase additional items. Obviously, there's a problem that where some of those items are available now, the price is significantly inflated. So we're trying to source products at a fair pricing to see if we can start to replenish and when we can start to replenish. But again, as the supply starts to catch up with the demand, that's when we will see the numbers return to normal. Right now, it's estimated we have approximately a week and a half worth of gear for our first responders before we're going to start to run low. And right now, our critical care facilities seem to be appropriately stocked. Again, that's a conversation we have daily with them to make sure they have the gear to keep themselves and their patients safe.
Thank you. We did hear on Tuesday from Council on Aging Director Gretchen Emmets that she's received donations of some of the handmade masks from some of the volunteers around Pembroke. We have quite a community of not only people who are able to craft these items and really design them in fantastic ways, but she's been receiving some of those and in turn distributing them through the Meals on Wheels program. Yep. And some of the drop-offs that she's been doing, because she's picked up some of the clientele that the pantries have been unable to serve through that break in the supply chain that we referenced earlier. And I know that they're looking to get back into the swing of things once the peak level's off. But anyone who has a real need for a facial covering and cannot procure a bandana or, not a turtleneck, but something that equally would cover their face, can reach out to the Council on Aging, and she's happy to distribute those. We have folks who are economically challenged. We have some folks who have different disabilities, and we obviously have a senior population. And we've noticed some of the seniors who are over 60 just don't want to self-identify as seniors. But that's okay. You can still have a mask, and all you have to do is reach out to the Council on Aging, and they'll get you one. They have a nice drop box outside. They can put it out there for you, and you can go pick it up. So that's excellent information. And Representative Cutler, I wanted to throw back to you on some of the food sources, and we have some food insecurities that are still going on while we're seeing this disruption in the supply chain. And I know in your district, you have so many towns that are working through the same thing. And on the Pembroke website, under our COVID updates, we have some of these local and regional food opportunities for people who really have insecurity surrounding foods. I was wondering if you could talk a little bit to that and explain to folks how that works and where they could go, or some of the opportunities that are still available.
Yeah, sure. Thanks for bringing that up. In fact, just yesterday, the Project Bread came out with some great information that's available online about the pandemic EBT benefits, which are separate from traditional EBT benefits that provide SNAP, food assistance for families, and not just for folks who are on EBT, but other individuals whose kids may be on free and reduced lunch, who have food insecurity. So that is a new resource. We have some food pantries that are still operating. Unfortunately, some of the food pantries have had to essentially close their doors for safety reasons, and I know that is something that is an ongoing issue. I was very pleased to see the Board of Selectmen in Pembroke just voted this week to create a relief fund locally. With thanks and great deal to Gretchen at the Council on Aging to help have another resource for folks who may be willing to donate to the relief fund to provide assistance to Pembroke seniors or all ages, frankly, folks who may need a little help. So I know that's just getting up and running, and hopefully we'll have more information about that soon. But I wanted to give a plug for that because that was great to see the town stepping forward and helping to find a resource for folks who, because I can tell you, I've heard from a lot of folks who want to contribute and find a way and feel frustrated that they can't help and want to make a donation or want to do something, and so this is a vehicle for them to be able to do that. So I think it's being called the Pembroke Hope Fund. Maybe the name has been changed, but that was the information I had, and we'll have more information about that hopefully very soon. But thanks to the Board of Selectmen and Lisa, I know was very instrumental in that as well. So thank you.
Thank you. Julie, do you have any questions that have come in so far in the segment?
I do, and actually they're both for Josh. One of them is about the Paycheck Protection Program, which now has been they passed it. And there's a
Invigorated.
lot more money in it now.
Well, it will be. The Senate did it yesterday, but yeah.
There will be. The question is from the small businesses that were denied, or not because they didn't qualify, but because the funds ran out. Do they have to go through the entire process all over again, or after they got the notice from the bank saying, "Sorry, we didn't have the money. There's no more money left," can they just forward that application back again into the bank? Because that seems to be very confusing.
Yes, and thank you for bringing that up. And I've had a lot of folks asking about that as well. So the lenders, it's really dependent on the lender themselves, the bank, because this program, unlike some of the other financial assistance programs, is run through the banks. And so the banks take your application and they submit it to the SBA, and the SBA funds through the federal funds, which did run out. Congress has reauthorized them. The Senate voted yesterday. I believe the House may be taking it up today. It will happen, imminently. And so those funds will be there. And so it's most banks, from what I'm hearing, are going to just, if you had an application already in and it's in the queue, they will finish their process within the bank and the underwriting and so forth, whatever goes into that, and then submit it to the SBA. But I would caution everyone to please check with your bank. Some banks may have different policies. Some banks may be accepting new applications. Some banks may not be. But if you had an application already in, you should definitely check with your lender and don't wait. Do it today. Don't wait until the money is officially reauthorized, because there'll be a mad rush again, because this is a very popular program and there's a limited amount of money, even though it's billions of dollars. It's all over the nation, so it's spread out quickly. So I would urge everyone to talk to their local lender, and this is your local bank, whoever you're dealing with, to ask those kinds of questions and to find out, to be very clear about when the bank is going to submit your application, not just process it internally. That doesn't get you the money. It only gets you the money when they actually submit it to the SBA, and the SBA gives you the yes or the no. And then there could be a little bit of a delay to actually get the money. But at that point, you at least know that you're going to get it. So that's the key message I would have. Talk to your local bank, ask them when they're going to submit to the SBA, and if you need to take any steps.
Okay, great. Thank you. And that does clear it up, because that was definitely very confusing to a lot of people. The second question has to do with the pandemic unemployment assistance, which just kind of became available yesterday. I do have the website if you want me to call it up, but could you talk about that?
Great. Yeah. Well, cool. Bring up the website. This is fantastic, because I can't tell you how many people have been reaching out to us asking about when this was going to be implemented. There we go. So the pandemic unemployment assistance, calling it PUA, to distinguish it from the traditional DUA, is a benefit that was passed by Congress that is now being implemented by the states. And essentially, this is unemployment for people who don't get traditional unemployment, non-traditional workers, self-employed, what we call gig economy workers, freelancers, independent contractors. people who work in religious institutions, other folks who aren't eligible for traditional state benefits because their employers don't pay into the unemployment system. So it's a good benefit. And the way it works, there's this is the website. It's mass.gov/PUA is where you go. You'll need some basic information. You need you'll provide your social security number and your wage records from 2019. You don't have to have filed your 2019 taxes already, but you will need some 2019 tax forms. Okay, you don't have to have them filed. They'll be looking for your 1099s or your pay stubs or your bank statements, some proof of your income. The eligibility is up to 39 weeks, so it's a significant amount of time. And they are retroactive, so even if you take a little bit of time to get this up and running, if you qualify, your range will be retroactive to the beginning of February. And it is also, PUA benefits are also included in the federal extra $600 a week in pandemic assistance that was approved by Congress. So whatever your normal benefits would be based on PUA, you would get that extra $600 a week for a more defined period of time, which runs April 4th to July 25th of 2020. If you're able to telework with pay or you're getting paid sick leave, you're not eligible. Also, I would say if you are, if you have a full-time job, getting a full pay, and then have a part-time job as a 1099, you're not eligible on that either, just because those questions were asked to me already. And then just briefly, a couple other points, because we had a good call with our Secretary of Labor and Workforce Development actually just yesterday, who gave us some information about this. And she said, since it opened the day before yesterday, or is it just yesterday? My days are running together now. There have been 50,000 claims already filed. The remote call centers are now staffed upwards of 850 people compared to 50 back in January. The PUA application takes about 25 minutes to do online if you have all your paperwork in order. It runs 24/7, so you could wake up at 2 a.m. in your pajamas and file if you needed to. That's a little different than the regular DUA system, which has to do these batch processes at night and actually closes down for a portion of the evening. But the PUA is open 24/7. Return calls for support are made 7 days a week and up until 8 p.m. on weekdays. And so that was one key point, is that they're saying that some people are not taking their calls back because they may think it's maybe a telemarketer or something. And so if you see that number, it would either come up as a private number or would come up as the number 617-626-6800 on your phone. Pick up, because that's PUA calling you back. If you do qualify for traditional unemployment, you're not eligible for PUA as well. You can only do one or the other. And the last point I would make is that they're still doing virtual town halls every day. They've done one every day since the outbreak, except for Easter. And they're usually available in the morning, sometimes in the afternoons. They have a Spanish language version as well. And that's basically just like a Zoom call like this, but with, where you can zoom in and they'll walk you through the process of how to apply. You can answer questions and so forth. So it's a really good resource. I would encourage anyone who's having trouble to try that first, and then as a first step. So that's sort of the basics. It's a great benefit for folks. I know it's helping a lot of people in need, and I would strongly urge anybody who fits into that category to take a look at that mass.gov/PUA.
Thank you.
Thanks,
Thank you, Josh. That cleared it up.
Thank you.
That was all the questions I had for today so far, Sabrina.
Thank you, Julie. All right. So as we close it out and go around one more time, the concept of being in the throes of the peak, but maybe moving to a place next week where we can talk about the downside of that. Those words to anyone watching, to anyone who's catching this particular forum, it's April 23rd. We know that it's already on us. We're hoping that the next 7 days stay relatively manageable, but I wanted to start with Lieutenant McDonald and ask you, this next week coming up for people is going to be a situation where battle fatigue setting in, and hopefully the weather gets better because it hasn't been that great up until now. But what does the department hope that Pembroke residents listen to today?
Well, to your earlier point, this is a team effort, whether it's the current guidance or future guidance. It shouldn't be a police issue. It's a common sense issue, and people should police themselves, no pun intended.
Thank you. You're absolutely right, and I appreciate that. I'm sure people listening are loving your background too. I mean, very, very statesmanlike. I love it. Thank you. Thank you very much for being here today. All right, Deputy Chief, last words to Pembroke for the next week coming up.
So I'm not going to go with my usual. I want to thank everybody for their effort in getting to the point that we're at right now. We've done well. So just keep up the good work and stay safe.
Thank you. Lisa?
I just want to touch back to what Josh Cutler was saying. Very important right now to pick up your phone. And it didn't occur to me until he said that. Not just unemployment, not just the gig economy callbacks and everything else, but contact tracing. Yes, the state will be using a contact tracing number that's supposed to identify it as COVID associated. But all these private nurses all over the place, all these public health nurses are working from private locations, mostly working from home for safety. Now is not the time to ignore unknown numbers. If it's a telemarketer, just say, I'm not interested, thank you, and hang up. But ignoring those numbers could slow your unemployment. They could slow your claim. They could slow your bank loan. They could slow your contact tracing. They could slow you getting notified if you were exposed to COVID. So now's the time to be vigilant. Now's the time to pick up the phone if it rings. Now's the time to wear a face covering. Now's the time to be smart and social distance. If we do this and we do it well over the coming weeks, hopefully we can start to do a slow reopening of the state and we can get back to our new normal sooner rather than later. But ignoring any and all of those things are only going to have a detrimental effect on your personal life.
Thank you. And to your point, if you want services from your local government, I want to make a plug for local government. You have so many of your folks that you're supporting in their roles to support you with tax questions and with permits. You know, how is that going to roll out in the future? And I want information from my file, and I have trash questions. Some of these callbacks are coming from remote workers, so you can't use that old caller ID as your barometer anymore. You're absolutely right. And thank you, Representative Cutler and Lisa, for bringing that up. And one last thing for Representative Cutler, your last words to Pembroke on your way out here. And what kinds of things
sounds really foreboding.
what do you think they'll be bringing to the selectmen on Tuesday? Now, the selectmen are talking right now, just to keep everybody clear, they're talking about potentially moving their meetings to an evening time frame. There is so much activity that goes on with the government's updates, you know, Department of Public Health, the economic advisors, and too many things during the course of a 9-to-5 day where sometimes these meetings aren't able to catch an emergency management person or a representative because of conflicting calls. But what kinds of things, first of all, do you want us to think about this week? And what do you think you might bring to the selectmen on Tuesday?
Well, I don't want to, I want to make sure people tune into that. So I got to save my, no, I'm just kidding. I want to compliment the board. It's been great. I've been, joining their meetings for the last few weeks, and it's been great to be able to do that. I hope we can continue that when this crisis is over. It's nice to see how proactive our Board of Selectmen has been, along with all of you, of course. Lisa was talking about phone numbers. I'm just going to give out mine again, just for folks who may need to reach our office. My cell phone is 781-422-4001. You can leave me a message anytime. If I don't pick up, I will call you back. And echo what Lisa and everyone else has said. Thanks for tuning in, and thanks for all the great work that everyone here is doing.
Thank you, everyone. And Julie, can you close us out today?
Sure. Thank you so much, Sabrina. Just remember that every time we do this, it's date stamped right here on the screen, because information does change on a daily basis. And we have these COVID-19 updates for the town of Pembroke every Tuesday and Thursday at 9 a.m. So please make sure you join. And if you missed it, you can watch it again. Go to pactv.org/Pembroke for any of the meetings. Stay safe, social distance, wash your hands, stay positive, breathe. We'll see you next week.